For the past several years, a concerted effort to eradicate tuberculosis in Kenya has been underway. With the support of the Global Fund, implemented by the Ministry of Health in Kenya and Amref Health Africa. This partnership has been instrumental in enhancing health outcomes and service delivery to create resilient health systems nationwide.
There will be a great improvement at the facility level in terms of receiving the results in time and also tracing the clients who are positive TB for treatment, which has also in a way minimized the spreading in the community.
Now even the community has the confidence of bringing clients or patients to our facility now that we have the liquid oxygen with us.
They helped us in X-rays in pediatrics, which helped us to shoot our pediatric case finding from the previously done 8% to 15%.
Kenya is one of the 30 high-burden countries for TB in the world. Therefore, TB is of a key concern.
Over the years, we've seen a rise in the number of TB cases that are being notified, of course with a slight dip around the COVID period, but with over 97,000 cases being notified in the last year alone. And these are drug-sensitive TB and over 700 cases of drug-resistant TB. Despite the large numbers that we have seen being notified over the years, we still have a large number of estimated TB cases that are missed, because we estimate Kenya has between 128 and 133,000 cases per WHO estimates, which means we miss about a third of the estimated TB cases. For effective TB control, one of the things that we really need is resources. We have the government putting in investments towards TB control, but we also have donors and other investment partners coming in, and Global Fund being one of our greatest investors in TB control. And one of the things that we have seen is that the resources that have been invested in TB control from the Global Fund are managed both by the government through the National Treasury, but also by a non-state principal recipient, and that is Amref Health Africa.
So the Global Fund Tuberculosis Grant, essentially we want to identify the people with TB and then put them on treatment, thereby also decreasing the transmission that would occur in the community, ultimately leading to people free of TB in Kenya.
Through Global Fund support, we were able to develop a people-centered strategic plan that embodies human rights and gender-responsive strategies to controlling TB. And this was supported through a very engaging process where even communities and civil society were given an opportunity and a platform through Global Fund support actually to be able to participate in shaping the narrative within that strategic plan.
The Kenya Innovation Challenge for TB was a unique opportunity for organizations working with communities to showcase how innovative and impactful they can be in the national fight against TB. The main objective of Kick TB was to find missing persons with TB within the congregate settings. During the period, the project engaged 4 organizations to implement the Kenya Innovation Challenge for TB in 4 counties as follows: SEMA Limited in Nairobi, North Star Alliance in Mombasa, Resource Oriented Development Initiative in Nairobi and Kiambu, and Community Support Platform in Kakamega. For Kakamega, the innovation entailed the engagement of school-going children to screen their household members.
When our CHB came to school, she gave us this screening tool, and you went with them at home, then you started bringing them back, isn't it?
Teachers trained as TB ambassadors from selected schools were provided with competency-based assignment tools, which they distributed to learners from grades 4 to 8 after sensitization.
Na mnajua dalili za TB? Dalili ya kwanza.
The children were empowered with TB information so that they could screen their family members and return the tools to TB ambassadors for further action.
Nilikuwa na kohoa na Madam Nelly alitufunza tuende hospitali ati kutibu TB ni bure. Unatoa kikozi na unaenda unapimwa. Vile nilipimwa wakaniambia niko na TB, sasa ndio nikaanza kupewa dawa. Sasa niko na meza.
Kuna wakati mtoto alikuja kutoka wapi shuleni huko na karatasi akiniambia, wamenipea karatasi hii kishule, nataka uniambie kwa maneno 3 4.
Mwalimu amenipatia karatasi akinikuja na aulize eti baba unakohoanga?
Mimi nakohoanga.
Au watoto ama wanafunzi ndio our indicators kwa community. After kwenda nyumbani wana screen mzazi, wanarudishia mwalimu. Ile teacher naye ananipigia simu, naenda kuchukua hizo makaratasi, napigia wale wenye wako na signs na symptoms simu.
The patient was then referred to the health facility where he was tested and diagnosed with drug-resistant TB.
Kaniambia TB yenye uko nayo, uko na TB suku.
Drug-resistant TB is a big problem for us. Reason being, we see patients who suffer from drug-resistant TB having a more severe form of the disease, and the treatment for Kenya so far has been long and protracted, with patients being on treatment for up to 18 months.
So Global Fund on monthly basis during the period of the treatment, they offer social support. So that social support cushion them from the impact and the effect.
Nilianza kupata msaada wa Amref. Na hiyo msaada ilinisaidia sana kwa kuwa vile mimi mwenyewe nilikuanga sina nguvu, sina mahali penye naenda nifanye kazi. Nilichengama kwa nyumba, nilikuwa naishi kwa hii, hata ilikuwa haina dirisha, ndio nikaenda nikachenga hiyo.
From the Kenya Innovation Challenge Fund, 887,753 people were screened for TB. 91,345 people presumed to have TB identified, and 57,931 investigated. A total of 3,747 were identified with TB, out of whom 3,542 were initiated on treatment. With the support of the National TB Program, these innovations have been incorporated into routine community TB case finding activities for the country and will be implemented in additional counties in the Global Fund Grant Cycle 7.
The other bit of the interventions that we were doing under the TB grant was under the C19 RM. Under this, we got funding again from the Global Fund, and essentially during the time that we had COVID, largely it was supporting the oxygen ecosystem throughout the country. But then in addition to that, we've had this more or less change with the COVID landscape changing. Now that not much of really an issue, we've then had to reinvest those particular resources in what we are now calling pandemic preparedness.
Before the COVID-19 pandemic, oxygen availability in public health facilities could have been higher, with only 16% of facilities adequately equipped. The existing infrastructure and supply systems were far from optimal, leading to significant barriers to access, as reported by most facilities.
It was a bit cumbersome for most hospitals because we had not put in measures in which we can have oxygen supply, and many patients suffered from lack of oxygen.
The pandemic significantly exacerbated this issue, dramatically increasing the demand for oxygen and causing costs to surge by over 75%. In response to this urgent crisis, Amref Health Africa stepped in with critical support funded through the Global Fund COVID-19 response mechanism. The scope of the work included refilling both compressed and cryogenic oxygen for 315 facilities, procuring a substantial number of 20,620 oxygen cylinders, and installing 14 bulk liquid oxygen tanks. Additionally, 22 oxygen generating plants and 364 centralized manifolds with oxygen piping were set up to ensure a steady and reliable supply of oxygen.
Right now, if such an incident is to happen, at least with the bed capacity that we have and the bedside supply of oxygen, we'll be able at least to handle such cases, if not the severe, the ones that need ICU, but the bedside patients will be able to get assistance.
This extensive support was carried out in close collaboration with the Ministry of Health's Division of Health Products and Technologies.
The other area that we have seen supported for TB diagnosis is our sample referral system. Despite the many investments we've made in terms of availing the equipment, we are not able to have a diagnostic equipment in every facility. What that means is that then there is need to network the facilities so that as the testing is being done, then samples can be moved from peripheral facilities that do not have a testing equipment to a place where that can be done and the results are relayed back.
Before the Amref came in, sample could take long time before they reach to the testing hub. So this could lead to patient not being getting the results on time.
They offered a support for the riders. We have 14 in our county. They were taken through infection prevention and control training, and they were provided with cooler boxes for the safety of the samples as they refer.
Integrated sample referral network was a strategic approach to streamline and enhance the efficiency of laboratory services. The approach was implemented in 9 arid and semi-arid land counties: Lamu, Meru, Nyeri, Nyandarua, Laikipia, Samburu, Isiolo, Marsabit, and Taita Taveta. The centralized coordination by the Ministry of Health through the National Public Health Laboratory ensured that there were standard guidelines to guide the activities such as sample collection, packaging, transportation, and reporting of results. Samples meant for reference labs were transported to Level 4 facilities where they were then packaged and transported to the national reference labs. Apart from TB samples, other samples such as viral load, full hemogram, stool, among others were also transported for testing. The model helped improve turnaround time, accessibility, and quality of diagnostics.
The other thing that we are doing is the PPM or public-private mix. And under this, essentially, we are saying there are private facilities that are providing services. People go to them, but they're not offering TB services. We have been able to expand into that space, and a lot of private providers have then been engaged to get involved in TB work.
The support we got from Amref are several. One, they helped us in what we are calling public-private partnership, where they helped us with the leakage assistance. And they also helped us in community TB, and they are helping us with contact tracing.
Nilikuwa nakula chakula na siendi haja kubwa. Nikaenda hospitali, nikaambiwa sasa hapo hii ugonjwa wako inaweza leta shida juu sasa hizo chakula zote zinabaki kwa tumbo.
He presented to a facility complaining of diarrhea. I sent the patient to do colonoscopy and it demonstrated the anorectal tuberculosis.
Before they came, we were at around 8% private contribution to TB cases in Kiambu. And then after they come in 2022, October, we are doing around 14% of TB case finding in private facilities.
Through the private-public mix intervention, 2,715 health facilities have been engaged and supported. 8,146,000 111 people screened for TB, 456,584 people presumptive for TB identified, 237,486 people investigated for TB, 22,202 people diagnosed with TB, and 21,577 people initiated on treatment. Despite challenges like COVID-19, we have made remarkable strides. TB case finding has increased from 72,943 TB cases in 2020 to 97,126 cases in 2023. The treatment success rate of all forms of TB has increased from 83% in 2018 to 88% in 2023. The percentage of cases with drug-resistant TB successfully treated improved to 88% in 2022 from 72% in 2018. The number of TB cases notified from the community increased from 8,969 in 2020 to 10,785 in 2023.
The fact that we are able to really work well with the national and county government is a plus, because that then provides an enabling environment where you can receive the required support.
Familia na marafiki wamenisupport kwa hiyo muda. Nashukuru juu sasa nilipona.
Additionally, under community system strengthening, 18 community-led organizations that benefited from the ODSS training received donor funding to sustain health implementation.
So what we are doing essentially is to identify organizations who then are taken through this ODSS training. This equips them with the skills and knowledge to be able to really operate well.
So my name is Ruth Moody. I am the Executive Director of Empower Gas Plus. Empower Gas Plus is a youth-led organization that works closely with adolescent girls and young persons. When we started, we were not having policy documents that are guiding on how we are working. There are organizations that tried partnering with us, but upon realizing that we were not compliant to several things, they would back out.
So with that, they are able to undertake activities that include TB as well, even if they are not directly funded by the Global Fund. Some of the organizations actually end up even having income-generating activities, and from the resources that they are able to generate, be able to support certain health activities, which then is a sustainable way without just saying that now they are waiting for the donor to be able to do something. In addition to that, we now have what we are calling community-led monitoring under the community system strengthening again. And here, essentially, we are saying the services are provided, there are resources that have been given. So how do you ensure that there is accountability for the same?
We engage the peer monitors to sensitize the community to be able to report issues, whether it's compliments or complaints about the service delivery once they visit our facilities.
So the reporting that tool that I monitor, and then we go through it, and we pick the burning issues where we discuss them with the management of the facility for implementation.
For example, if it's about an issue about hormone, and I see from the back end that a community member has raised an issue, maybe in a specific facility, I then link up with the county pharmacist so that I can gather information so that I respond back to the wananchi who has raised that query.
Kuna services zingine ambazo tumezipata kupitia hiyo iMonitor. Kama hiyo incinerator tulikuwa huko, imeletwa huko sasa TB clinic iko free, iko peke yake. Alafu pia kuna shida ilikuwaga ya wagonjwa wa TB walikuwa wanachajiwa hizi nutritional supplements. So kupitia iMonitor wakakaa chini na facility wakaamua kuiwaive. Sasa hizo wagonjwa wa TB wanapata hiyo chakula yao, nutrition yao vizuri, hawalipi tena pesa yoyote.
It has also helped to empower communities to do research about issues that affect them, and then after the research they are able to do advocacy around them.
Other interventions such as TB self-screening, Targeted TB outreaches and engaging the private sector paved the way for a TB-free future.
I'd like to thank Global Fund, the Ministry of Health, through the National TB Program, and Amref for their continued support.
They have done a very good job in our account.
We are really happy because it has brought hope for our patients.
And I would love the world to know that we are so much happy and we are so much grateful for this noble training that has helped transform us.
We still have the opportunity that no generation in the history of humankind has had. The opportunity to write the final chapter in the story of TB.